It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following. Does your dog have difficulty to urinate? Bladder stones. Bladder stones in dogs can make urination a painful experience. The stones can even prevent urination altogether. If you've ever had bladder stones, you can imagine how uncomfortable it is for dogs. Bladder stones must be diagnosed and treated promptly so that affected dogs can return to urination comfortably. 1. What are bladder stones? Bladder stones, also called uroliths or cystic stones, are mineral formations in the bladder and resemble rocks. They can be as small as grains of sand or as large as gravel, in some cases even larger. Dogs can develop many different types of bladder stones. The most common types are struvite, magnesium ammonium phosphate, calcium oxalate, and urate. Struvite stones are the most common overall and tend to occur more frequently in female dogs. Calcium oxalate stones are more common in male dogs. Certain breeds of dogs are more prone to bladder stones. The following breeds of dogs may be at increased risk of developing bladder stones: Miniature Schnauzer, Shih Tzu, Bichon Frise, Lhasa Apso, Yorkshire Terrier. The bladder of an affected dog may contain numerous small stones or several large stones. Sometimes smaller stones can get stuck in the urethra. This scenario, called urinary obstruction, is a medical emergency. Bladder stones can occur at any age and grow quickly or slowly. 2. What causes dog bladder stones? When the urine contains an excess of certain minerals, such as magnesium, the minerals can no longer dissolve in the urine and separate, forming crystals. These crystals rub against and irritate the lining of the bladder, creating mucus. The mucus and crystals clump together and eventually form bladder stones. Several risk factors can trigger the formation of stones in the bladder, and they are: bladder disease, including urinary tract infections; urine acidity level, pH, too high or too low; excess minerals in the diet; abnormal metabolism; reduced water intake; genetics; medicines; systemic disease, including kidney disease and diabetes. 3. Signs and symptoms of bladder stones in dogs. The most common signs of bladder stones in dogs are blood in the urine and straining to urinate. Other symptoms include frequent urination, genital licking, abdominal pain, and urinary accidents. Peeing only in small streams or not at all is a medical emergency. When a dog is unable to urinate, toxins that are normally excreted in the urine build up in the body, making dogs seriously ill. The following signs may indicate a urinary obstruction: urinating small amounts frequently; straining to urinate with little or no urine output; your dog takes a long time to urinate; blood in the urine; urine drips instead of coming out as a stream; lethargy; vomiting; pain or vocalization when urinating. The signs of bladder stones and urinary obstructions may resemble those of other urinary tract conditions. If your dog shows any of these signs, make an appointment with your vet immediately. For how to treat bladder stones in dogs. The three main treatment options for bladder stones in dogs are surgery, urohydropropulsion, and dietary dissolution. The type of stone, the location of the stone, and general health will determine what treatment a dog needs. Surgery. Surgery is the fastest and most effective treatment for bladder stones in dogs. It is recommended for dogs with numerous bladder stones. Emergency surgery is required if a dog is unable to urinate due to stones. Urohydropropulsion. Urohydropropulsion is a non-surgical treatment in which a catheter is inserted into the bladder and the stones are flushed and analyzed. Dogs are anesthetized or sedated for this procedure. The stones must be a certain size for this procedure to be successful. Dietary solution. Dietary dissolution involves feeding a special diet that will slowly dissolve the stones. This is a good option for dogs with struvite stones. This is not suitable for all types of stones, but a diet change may be recommended in dogs that cannot undergo surgery. Bladder stones cannot always be prevented. However, some prevention strategies can reduce the risk of stone formation. Provide your dog with unlimited fresh water. Consider feeding your dog wet food. And you have to treat underlying diseases. If your dog has had bladder stones or is a higher risk breed, your vet will advise you how often your dog will need monitoring. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.